conversation on schizophrenia. Firstly, what is mental health and what causes mental health disorder?
Mental health is absence of mental issues, mental tensions, mental worries, and living at peace. That is mental health. And mental illness is absence of peace of mind, absence of anxiety, presence of anxiety, and presence of other social factors which leads to mental illness.
Okay, thank you, sir.
And one more thing is that mental illness is as much an illness as a physical illness.
Okay.
Like, if you have malaria, you have a physical disorder.
Yeah.
Similarly, if you have schizophrenia, you have a illness.
Yeah.
So almost similar condition.
There are various types of mental disorder. One such type is schizophrenia, as we knew that schizophrenia is a mental disorder. What are the causes of schizophrenia?
As yet, we do not know the exact cause of schizophrenia. However, there are multiple factors which leads to appearance of the disease called schizophrenia, and the factors involved are biological and psychosocial. If you talk about biological, then it includes genetic factor, like if there is schizophrenia in the family, the possibility of other members having schizophrenia is more than any other family where there is no schizophrenia. Then there is biochemical, where there is abnormality in the chemical setup inside the brain. There are certain small liquid chemicals inside the brain which we call neurotransmitter. There are about 10-12 neurotransmitters inside the brain, and in schizophrenia one group of neurotransmitter becomes more and one group of neurotransmitter become less, which leads to this illness. Besides that, there are psychosocial factors, in the sense that excessive stress, anxiety can lead to appearance of schizophrenia. Then abuse of substance like alcohol and drug can also precipitate schizophrenia, though they are not cause of schizophrenia, but they can lead to appearance of schizophrenia.
Okay. So, can someone with schizophrenia be aware of it, that he is suffering from self-diagnosis?
The primary criteria of all kind of psychosis, including schizophrenia, is loss of insight, that is the person's awareness of the illness. So, he is generally not aware that he has an illness and he does not want to take treatment.
Okay. So, why do people with schizophrenia isolate themselves? They isolate, they want to stay away from their family, they want to live alone, they want to be in a darker room, or they don't want to communicate with the common society, I would say. Means they are very isolated, they don't want to mix with us.
Because the experience they go through while they have schizophrenia is such that they feel that other people do not understand them, and that is the reason they isolate themselves, and to the extent that some people even migrate to areas where there are less people and stay all alone.
So, recently an schizophrenia and dangerous behavior, an article that was published by the New Indian Express on April 21st, 2022, a 35-year-old man with suspected symptoms of schizophrenia has surrendered before the police after killing his wife, suspecting her of plot to get him killed and assumed that she was having affair with his brother. This dangerous behavior can be seen in a schizophrenia patient. What do you say on this regard?
Honestly speaking, this kind of dangerous behavior was common about 20-25 years back, where people were not very keen on getting early treatment. Now these days the people are aware of the necessity of treatment, and so this kind of behavior is not very commonly seen, in the sense that in my last 40 years of experience, I haven't seen a single case of a patient, schizophrenic patient murdering another person.
Okay.
Quite uncommon these
It's
days.
nowadays it's
Now, because of the
uncommon.
early treatment.
Early treatment and diagnosis and treatment. What type of diagnosis? How can a person know that he is what medical diagnosis and treatment I am talking about?
Diagnosis we make mainly on symptomatology. There is no definite investigation by which we can diagnose schizophrenia. We depend on the history and the symptomatology that the patient presents with, and from there are certain specific symptoms which are very commonly seen in schizophrenia. If those are present, then we make a diagnosis of schizophrenia.
Okay, sir. What should people with schizophrenia avoid? You have told it. Again, I would like to repeat this. What they should avoid means alcohol, drugs.
They should avoid alcohol, drug, stressful conditions, and these are the things they should avoid.
So now on 24th of May, World Schizophrenia Awareness Day, but very less people are aware of it. So how can we observe this day? Being a retired professor, you might be having a lot of experience on it. So how can we observe these days for the awareness of schizophrenia or mental health?
We should do program like what we are doing now and let people know the various aspects of schizophrenia, so that they can understand that what their relative is having is an illness and needs treatment, not, even today there are people who believe that these are all because of black magic or effect of bad soul. So whenever we get a case of schizophrenia, it is generally we get it second hand, because the first time they always go to a Baz or a Oja and get treatment, and after that they come to us. When the Oja and Baz fails, then only they come. By that time, very precious time is lost. So if the people is aware, then they will come straight to us. And the fact is that the earlier the treatment is started, better is the result.
Okay, thank you, sir. So lastly, how can we reduce mental illness stigma? There is a stigma.
Only way we can reduce stigma is to make people aware, understand what is mental illness, making them understand that mental illness is as much like a physical illness. Physical illness occurs in the body below the neck, and mental illness occurs in the brain above the neck. So it's only the body part which is different, but illness is almost same.